Welcome to USA Global Providing USA experts and audiences all around the world to succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Good afternoon, everyone. It is Monday, October 21st, and this is episode 6 of The Holistic Alternative. I am Julie Ann Mejia, and today we have a beautiful guest joining us, a physician with previous experience in emergency medicine, over 30 years of experience as a coroner, a well-known medical cannabis advocate, medical director of DBI Tactical, and a clinical consultant at Apollo Applied Research, to name a few. Today, we welcome Dr. Barbara Mainville to the show. Thank you so much, Dr. Barbara, for taking time out of your busy schedule to be with me today.
Hi, Julie. It's a pleasure to be here.
Thanks so much. I hope you're having a beautiful day, and I'm so excited that you could take time out of your schedule after clinical to join us today to talk about some different issues within the space.
All right. Where would you like to start?
Well, let's talk about some of your background. I mean, you have done so much for patients within the space. Let's talk a little bit about your background.
Okay, so yeah, I graduated from medical school back in 1985, worked 30 years in an emergency room, 30 years as a coroner for the province of Ontario, conducting both investigations and inquests. And then at the beginning of 2016, I decided that 30 years of that was enough. It's someone else's turn to do that stuff now. And I moved over into cannabis, and it's just been fascinating.
What was your push to get involved with, plant-based medicine?
Well, initially, when I left the ER, I wanted to do something different. The usual trajectory is people leave the ER, they go into administration, maybe they go into research, maybe they go into walk-in clinics, and it's like, well, that's boring. And so I wanted something different. And so they were opening the Cannabinoid Medical Clinic in Ottawa soon at that point. And it's like, well, that sounds different. And but I had no idea what any of it was about. I never used cannabis when I was younger. I really didn't know anything about it. And then as I started to learn about it, it's like, wait a minute, this stuff doesn't kill people. And I'd never put it together. In the emergency department, we'd see the occasional teenager who was partying with his buddies and used too much of the wrong stuff and went on the proverbial bad trip. Buddies would bring him in, we'd give him something to sedate him, let him sleep it off. And a few hours later, he'd get up and be able to leave, no problem. In the coroner's work, any deaths that I saw that were related to cannabis had to do with the illegal nature of it and involved things like AK-47s, not the strain AK-47, actual AK-47s. And but I just never put it together that cannabis doesn't kill people. And so it's like, wait a minute, there's something out there that we can use to help people that doesn't kill them. Why aren't we using this more? And after 30 years in the ER and 30 years as a coroner, I am very interested in anything that doesn't kill people. And so that was sort of the first big hook. And then as I learned more, it's like the main purpose of our endocannabinoid system is to maintain homeostasis. It's like that's everything. This is the key to our health and well-being. This is the holy grail of healthcare. And so when I came across that little bit of information, this was back in 2016. So there weren't quite the same resources that there are available now. And so I certainly had to do some digging. But when I found that, it's like, whoa, this is really important. And it doesn't kill people.
No, absolutely. And that's a great point. A lot of people don't understand why their immune system functionality isn't optimal. And that's typically the missing piece is endocannabinoid, functioning.
Yeah, the one of the fascinating things about the endocannabinoid system, for anybody who isn't aware, we all have our own internal endocannabinoid system. We make our own cannabis-like substances, and this system is dynamic. We form the circulating endocannabinoids and the receptors on demand as we need them, and it's a fat-based system. So in order to form these substances and the receptors, we need the proper building blocks. And for decades of low-fat diet has really interfered with the availability of those building blocks. Of course, the sugar that goes along with the low fat has not helped in any way either, but specifically with the endocannabinoid system, the lack of healthy fats has really been detrimental to people's health. So that's really the first step to working with the endocannabinoid system is supporting it with a healthy diet. And there's certainly, there's lots of diets around. I think basically I don't look at diets as diets. I look at them as ways of eating, and I think the Mediterranean diet is probably the most reasonable and realistic and healthy way of eating that there is out there, with lots of fruits and vegetables, fresh fruits and vegetables preferably, but also a lot of nice healthy fats. In the Mediterranean, of course, it's all olive oil and sardines, but there are certainly other sources as well. Hemp is actually a wonderful source of omega-3.
Absolutely. We should be providing hemp products. Our ancestors ate them, consumed them, applied them, smoked them for thousands of years to develop the endocannabinoid system. I think, a lot of times, like I said, that's the missing piece. People are not exposed to these compositions anymore, and therefore their immune system is a mess, and their gut health is a mess. A lot of illness stems from the gut, as you know.
Any disease, any illness, any deviation from normal health basically comes back to a malfunctioning of the endocannabinoid system. It's the endocannabinoid system that keeps us normal and healthy. And so any deviation from that, at least in theory, can be related to a deviation in the endocannabinoid system. They've been able to actually illustrate that quite clearly in PTSD. But even with, basically anything else, if you think of something like rheumatoid arthritis, it's the endocannabinoid system that monitors inflammation. It monitors the immune system. It monitors the release of cytokines. Everything that goes haywire with rheumatoid arthritis comes back to something the endocannabinoid system is responsible for.
And that's a beautiful thing. And people don't know, or they're not aware, terpenes and flavonoids are found within the human body. Milk, within breast milk that's produced. It's found in different foods. So really eating cleanly in foods that are appropriate to activate the system, that's always a plus as well. And you brought a beautiful point in regards to different functionalities for some of these cannabinoid and terpene therapies. I know you've worked a lot with traumatic brain injury patients. Is that correct?
Well, I certainly have a good number of them that have been diagnosed with TBIs or post concussion syndrome or both. But one of the topics that I find really interesting, but also rather scary, is the undiagnosed head injuries, undiagnosed brain injuries. So for a number of years now, they have been able to demonstrate that people exposed to blasts have a different pattern of brain injury compared to people who get say concussions playing hockey or football.
Okay.
And so a typical concussion, there's special imaging that can be done, diffusion tensor imaging, diffusion tensor MRIs that can show up it shows the flow of water along the length of the axon, and so it can show areas where that water's not flowing properly. So if you do this very specific imaging on people with a concussion they sustain, say playing football, then you can actually identify that there is an injury there. Now, it cannot be proven definitively that those injuries, that type of injury causes CTE, the chronic traumatic encephalopathy that so many of these people are dying of. You can't prove definitively that that's what's causing it until you actually autopsy their brain. We can suspect that there are biomarkers that are helpful, but we can't confirm them until we've autopsied the brain. And so this whole process is very, very slow. And of course, as a clinician, my goal is to keep those brains out of the hands of the brain bank as long as possible and keep them in a living, breathing person. Once the person does finally die, yes, the brain bank is very welcome to examine them, and I appreciate very much the work that they do. But it's a long process, and if as clinicians we're doing our job right, it's a very, very long process. But with the blast injuries, what's different about them, the pattern of injury is different. So they call it astroglial interface scarring, and what it means, just the word interface, it's at the border. It's where the nerve tissue connects with the surrounding tissue, and so this doesn't show up on any of the imaging that we have. It can only be found on autopsy. And as they autopsy more brains, they're realizing that this type of injury is not that uncommon. And what's very concerning is that they're now finding that some people will demonstrate on autopsy the same injury pattern without ever having been in combat, without ever having been exposed to a blast. One of the mass shootings in recent years, I forget exactly which one it was, but you have so many in your country.
It's terrible. Terrible, I know.
But the shooter, when they autopsied his brain, showed this same injury pattern. And he was a reservist who was an artillery instructor. So never been in combat, never exposed to a blast per se, but just firing artillery all day long. And so it's like, okay, so firing artillery can result in this. How much artillery is safe? Well, we don't know. How many blasts are safe? What distance from a blast is safe? All these questions, we just don't know. And so if you look at the fact that we've just come out of a 20-year conflict, there are an awful lot of veterans out there that have been firing guns and may or may not have been exposed to blasts. And some of these guys, do have headaches and symptoms that suggest that, maybe there's some brain damage going on, but some of them don't. And some of them really present with psychological symptoms, and they're treated as such. They may or may not have a known exposure that would explain the psychological symptoms. Somebody who's diagnosed with PTSD, well, what is this related to? And they may or may not have something that can be connected to. But what they're finding is that some of these guys are being diagnosed as having PTSD or other psychological issues, maybe depression. And when they finally can't take it anymore and decide that it's time to go, when their brain is actually examined, they're finding this injury pattern. And so how many of the veterans out there who are diagnosed with PTSD, some of them certainly have backstories that support the diagnosis of PTSD, but is there maybe more to it? Do they have PTSD and an underlying brain injury? If there's no real supportive backstory, are their symptoms entirely on the basis of a brain injury? And one of the really nice things about working with cannabis is, while we're treating their presenting symptoms, if they're presenting with symptoms of PTSD, we can help them with the anxiety, we can help them with the depression, we can help them with the sleep, knowing that at the same time, the CBD is, through its neuroprotective properties, actually helping their brain heal. There's a really interesting piece of research out there that where the authors have demonstrated that at least one of the ways that CBD does this is by recruiting neural stem cells. So it's working at a very, very fundamental level to help the brain heal, without needing to determine for sure whether the brain actually needs to be healed or not. We know that this is doing it at the same time that it's treating the person's presenting symptoms. And it's like, this works for me. I am very happy to recommend this to my patients.
No, it's incredible, and it's fascinating information because it really opens the door to other agencies, right? Law enforcement, federal agencies that are constantly having to train with guns. And they're wondering why they don't feel well. So again, you're not only having neuroprotectant support with some of these cannabinoid therapies, but you're having regenerative if you're already having brain issues. So
exactly,
it's a phenomenal thing with limited to no side effects. So, it can't be any easier or healthier for the patient. It's natural, it's non-synthetic, and it's non-addictive. So I think that's a beautiful thing to be able to offer to your patients. So I'm so happy you're doing this.
Yeah, so am I. And if you look at the pharmaceuticals, the gabapentinoids are often prescribed for nerve damage, neuropathic pain, post-concussion syndrome. Well, the gabapentinoids actually block the creation of new synapses. They don't promote the creation of new synapses the way CBD does. They actually block the creation of new synapses. Psychiatric medications, antidepressants, benzodiazepines, sleeping pills are increasingly being linked with early dementia. Even something as simple as Benadryl, off the shelf, you don't need a prescription, easy to get, feels like it's been around forever, must be safe. Well, no, research has demonstrated that people who use even small doses of Benadryl on a regular basis are at increased risk of early dementia. Anti-inflammatory
Omeprazole as well. That's a huge one. We've seen a ton of research backing that. People need to get off of those and clear their gut health and heal so that they don't have these symptomologies. I didn't mean to cut you off. Go ahead.
Yeah, anti-inflammatories. With post-concussion syndrome, we know inflammation is an important component of it. So it's like, well, we have these anti-inflammatories, we can use them. Well, things like Advil are very good anti-inflammatories, very effective anti-inflammatories, but they're so good at blocking inflammation that they not only block the excess inflammation, they interfere with the normal healing process. Inflammation is the first step in our normal healing process. So a few years ago, there was some research that was looking at fractures. Some physicians, some orthopedic surgeons were getting concerned about the opioid crisis, rightly so. And so they decided they would do a study and they would start fixing people's fractures and send them home with Tylenol and Advil. I'm going to assume that none of these people who designed the study had ever had a fracture themselves, so they never would have considered this. But the poor patients, not only was their pain miserably undertreated, the fractures didn't heal. The Advil was blocking the normal healing process. So these people ended up with non-unions. More recently, earlier in 2024, around the beginning of the year, there was research that came out showing that regular use of NSAIDs is associated with the development of chronic pain syndrome. And it's like, well, that makes complete sense because you're taking something that potentially could heal, something that's painful that potentially could heal, but you're blocking it. And so really not a surprise if you understand the background to that. Cannabis, on the other hand, promotes normal healing. So if you took the very same injury and one person was using anti-inflammatories, they would have to keep taking those anti-inflammatories basically indefinitely. Somebody using cannabis, the problem actually is allowed to heal. And so something that could potentially become chronic gets healed and the person can go on with their life.
Yeah, and it's minimal damage to the body, right? A lot of these NSAIDs, they create bleeding ulcers, different things in the gut, on top of, like you said, masking the symptomology and masking the healing process, which is, creating all this other havoc in the body. These products are safe for pets. They're safe for pediatric populations as well. I know you've worked with some of the pediatric patients with cannabinoid therapies as well. Let's talk about safety with children in some of these cannabinoids.
Well, compared to pharmaceuticals, I mean, everybody would love to have a child who's happy and healthy, and that's certainly, the ideal. It's not always the reality. And so when you're looking at pharmaceuticals, cannabis, CBD in particular, compares very, very well. And there's so much stigma about cannabis, though, that even CBD, it's like, oh, it's part of the evil cannabis plant. It must be doing something awful. And if it's working with the system that's responsible for keeping us healthy, should we really be messing with this in our children? And the thing is, we're already messing with the endocannabinoid system. Every time you give your child Tylenol, you are messing with their endocannabinoid system. And so why not work with it and use it to our advantage, use it sanely and rationally? And with CBD, certainly the three areas that are best established by the research that it only blocks excess inflammation, not the normal healing. It's an immune modulator. It pushes the immune system towards normal, and it's neuroprotective, regenerative. Those are the three areas that are best supported. But all the other research that's coming out looking at other symptoms is showing that, not surprisingly, it's pushing everything else back towards normal as well, which is not surprising when you think of the role of the endocannabinoid system. So things like gut function, renal function, liver function, bone density, everything is being pushed towards normal. So with children, it's like, why not use something that's actually going to not only treat the issue we're trying to treat, but at the same time help to keep the rest of them healthy as well. And just a little bit further with the endocannabinoid or the NSAIDs, stomach ulcers, absolutely a big issue with them. They also cause a lot of strain on the kidneys. And CBD, on the other hand, helps to keep the kidneys healthy. A lot of other medications put a lot of stress on the liver. And so there was research a few years ago that created some rather shocking headlines. CBD may be toxic to the liver. Well, if you look at the study that was based on, first of all, it was done with mice, but the doses of CBD they were giving these mice were crazy. They had 4 groups. One was the control that got nothing. One they gave 60 milligrams per kilogram of CBD per day. Who's taking more than about 4 milligrams per kilogram.
Yeah, it's crazy. And not only that, the additives that they were using for those controls, right? I think they're using like really harsh solvents. So it does make you question and wonder, the carrier in itself, could that be the root cause of the issue? I think they were using Hexon in that study or something crazy.
I'd have to go back and look at it, but they had the 3 groups using CBD. There was 60 milligrams per kilo, 180 milligrams per kilo, and 600 milligrams per kilo. And the introduction to the study is really misleading, keeping in mind that most physicians don't really have a frame of reference to interpret these amounts. And they said this would be roughly equivalent to the amount of CBD that people are using. And it's like, no, it's not. So, yeah, don't use 60 times more cannabis than you need. Don't use if you use 60 times more Tylenol than you need, it would kill you. So don't do that. If you drank 60 times more water than you needed, it would kill you. So don't do that. Does this mean you should never, ever touch Tylenol or not drink water? Of course not. Just do it rationally. Don't overdo it. And subsequent to that study on the mice, a different group did a study looking at actual people using CBD in the doses that actual people really take. And they found that the patients who actually had pre-existing liver damage for whatever reason, the CBD actually helped to heal it.
Absolutely. And I believe that totally. I think it's a natural, it was put on this planet for people to consume it because it's a medicine. And I believe that fully.
Yep. And so CBD, very, very helpful. But yeah, there's so much else in the plant. And we're really just scratching the surface. So THC, obviously, most people are familiar with to some degree. Too much THC, not good. And there is this idea, in Canada, we've had a recreational market for 6 years now. 6 years as of a few days ago. And on the recreational side, there does seem to be this idea that there's no downside, that you can use as much cannabis as you want and there's no downside. And that's absolutely not true. Drinking too much water will kill you. THC, certainly compared to pharmaceuticals and compared to other recreational substances, compares very, very well. But if water can kill you in excess, it's not really a surprise that THC, if you use enough of it, can have some downsides. And so I do want to acknowledge that and make sure that people understand that too much is different from using a therapeutic amount. And, Tylenol can be helpful, but not when you use 60 times more than you need. And so So yeah, certainly safety wise, very, very good. But the THC needs to be used judiciously, and really, really keep the amounts, the smallest amount necessary. The dissociative effect is very helpful for people with chronic pain that just can't get a handle on it. Maybe they respond to CBD, but the amount of CBD they need, just it's they don't have the budget for it, and most insurances don't pay for this stuff. So THC used judiciously can help them live with their pain. The pain's still there. They know it's still there, but it's just not so much of a problem. Also really helpful for nightmares. Our veteran population, if they're not sleeping at night or they are so doped up on sleeping medication, they might show up for their psychotherapy sessions physically, but they're not really going to be able to participate them in a meaningful manner. Just because they're so full of sleeping medications that do carry over into the next day, and most of the pharmaceuticals are not overly good at blocking nightmares. Prazosin does seem to be useful, but it doesn't work for everybody. So often use THC to help with nightmares. Once they can participate in the therapy and address what's causing the nightmares, then certainly long-term, their requirements are very often less than they are initially. But THC absolutely has therapeutic applications. But then there's all the other stuff in the plant. And
Exactly.
So in Canada, we now have products with CBN and CBG. We've been working with them for about a year. They've been pretty easy to access. There's some CBC just coming onto the market now. I haven't had a chance to get any experience working with that yet, but that looks interesting. But then there's about 150 or so other substances.
Correct.
And then the terpenes, about 200 terpenes, and the flavonoids. I think there's 25 or 26 flavonoids, and two of them have been demonstrated to have greater anti-inflammatory pain relieving properties, 30 times stronger than aspirin.
Amazing.
So and so some of my patients, I have patients that grow, and in Canada, with legalization of recreational cannabis, every household can grow up to 4 plants. But prior to that, dating back to 2001, when medical cannabis initially became legal in Canada, the legislation has changed a few times over the years. But if somebody, the essential part now is that if somebody applies to Health Canada, if they have a medical document from a physician, they can apply to Health Canada to grow their own cannabis. And so some of my patients are juicing the raw cannabis.
Love it.
And so with the raw cannabis, the THC is still in its non-intoxicating acid form, THCA. CBD is CBDA, CBG is
Correct.
CBGA, and on and on. So all these cannabinoids are in their non-psychotropic acid forms, which have their own benefits that we're starting to learn about. We don't know as much about them as we do about the CBD and THC, partly because we haven't been looking, but also because they are the acid forms of the molecules are not stable. They decarboxylate to form the non-acid versions that people are more familiar with, and so they're difficult to ship. And they're difficult to work with in the lab. So we're starting to learn about those acid forms, but they're looking very interesting. And so many of these substances we don't even know what the decarboxylated form does, let alone the acid form. But a lot of what we typically think of as indica and sativa effects seem to come back to those background cannabinoids. An indica, people tend to remember it by saying indica, indicouch. So, you know, a sedating indica can, if you have somebody with depression, an indica can make that depression worse. Any motivation they might have, the indica will take it away. Indicas can be very helpful for things like bad anxiety, hypervigilance, those types of things. Indicas absolutely have their place, and they are great for sleep. Just probably not what you want to use for somebody who's having trouble sleeping and dealing with depression. Sativas, a typical sativa is very energizing and motivating, and can make anxiety worse, but there are sativas that have calming terpenes. So if somebody has trouble with depression, you're more likely to go to a sativa type, whether it's called sativa or it's more a sativa type hybrid. Everything's a hybrid these days anyway, but, you know, go more with a sativa, but with calming terpenes to help calm their anxiety. So, so there's all these other things we can work with, but just getting back to the raw cannabis, one of my patients in particular that comes to mind has psoriatic arthritis, just horrible inflammatory autoimmune disease, and she was missing a lot of work. Between the symptoms of the disease and the side effects of the medication she was on, she was missing a lot of work. Like very often 3 to 4 days a week she was missing, just because it was such a struggle. When she started juicing raw cannabis, she got off all the pharmaceuticals, and she feels better than she ever did before with the pharmaceuticals, and she almost never misses work now. And
Wow.
So, you know, how much of that is the acid forms of the cannabinoids? Which acid cannabinoids? I don't know, but I'm sure they're playing some role. The flavonoids, of course, when you juice raw cannabis, you're getting all the flavonoids, including those two that have 30 times more anti-inflammatory activity than aspirin. The terpenes, caryophyllene in particular, is known to have anti-inflammatory effects. So depending on the strain, that may be contributing. Really interesting aspect to cannabis that a lot of people aren't aware of. And so I do often like to mention it.
No, I think that's great. And, you know, I'm a firm believer in that as well, because it never made sense to me working in a lab setting for extractors pulling apart the plant and putting it back together and mixing up the terpene profile with the wrong cannabinoids. It just didn't make sense to me. And that's why, you know, I really do value the cold processing methodology that we do in our products, because you're truly preserving all the cannabinoids and all the terpenes from the raw organic material to be processed, and you're not losing anything, because as you know, everything burns off at a certain temperature. So traditional CBD companies are using heat extraction, and that's not a true full spectrum product. It's a broad spectrum product. So
Yeah.
it's
Yeah.
really interesting. And, you know, Dr. Barb, we're getting down to the 40-minute mark. I would love for people to know how they can get in touch with you. What's the best way people can reach out and connect with you?
You can find me on LinkedIn.
Okay.
That's probably the best way to contact me, and send me a message and connect with me, and
Awesome.
we will continue doing this work.
Keep up the great fight. You're doing amazing things for everyone in the community, and we're so grateful for all that you do. Everyone, if you want to check out her LinkedIn profile, it just showed up on the screen there. Dr. Barbara, thank you so much for taking time out of your busy schedule to be here today and to discuss these important topics, because a lot of people are unaware, they're uneducated, they have fears about these. I would tell people, you know, there's a lot of pharmaceuticals to be fearful of. This is a beautiful natural composition that truly helps the body return to homeostasis as it's meant to be. Anything else you'd like to add before we wrap up today?
Well, thank you for everything you do as well.
Thank you so much. I appreciate it. It's an honor and a privilege to have you here today, and thank you. Thank you for everything.
You're most welcome.
Everyone, thank you guys so much for tuning in today. We'll have another beautiful guest next month. This is Julianne Mejia, and we're signing off for today. Have a beautiful day, and please turn in and follow USA Global TV and Radio for more beautiful interviews such as Dr. Barbara's. Thank you guys. Have a beautiful rest of the day. Take care.